Okay. Your Excellencies, ladies and gentlemen, I'd like to welcome everyone to this webinar on the gendered impacts of COVID-19 and social protection responses in rural areas. It's an honor and a pleasure to have the opportunity to be the moderator for this webinar. My name is Benjamin Davis. I'm the Director of the Division for Inclusive Rural Transformation and Gender Equity at the Food and Agriculture Organization of the United Nations. And today we're going to reflect on the important role that social protection plays in the lives of rural women and girls, and how social protection can be designed with their empowerment in mind. This is particularly important to the context of COVID-19, as we have seen that the crisis is exacerbating existing structural inequalities and increasing the burden on rural women as they struggle to fulfill their multiple roles. Let me introduce the participants and give an overview of today's session. The webinar will begin by a welcome address by Maximo Torero, who's the Chief Economist of the Food and Agriculture Organization. This will be followed by a presentation by Susan Caria, the Senior Gender Officer with FAO, and she'll be giving an overview as to why gender-sensitive social protection is so important for rural women, boys and girls in the response to COVID-19. Her presentation will be followed by a second presentation by Ms. Lillian Mokgosi, who's a program policy advisor for the World Food Programme. And this presentation will focus on the gendered impacts of COVID-19 on the ground with rural Gambian women. Next up, we'll have a panel discussion with three speakers who will be sharing their experiences from their countries on the importance of addressing gender in the social protection response to COVID-19. First, we'll have Her Excellency, Ms. Naveen El-Kabaji, the Minister of Social Solidarity of the Government of Egypt. Welcome.
Thank you very much.
Welcome very much. And she'll be joined by Ms. Renana Jamvala, who's the chairperson of SEWA, Self-Employed Women's Association of India, as well as Mrs. Rohit Bitaya Darboe, the Permanent Secretary, the Ministry of Women, Children and Social Welfare of the Government of the Gambia. Then afterwards, this will be followed by a question and answer period where we can respond to some of your questions that you may have. Just very quickly, let me just introduce this series and this initiative. This is the 29th seminar of a webinar of the Social Protection Responses to COVID-19 webinar series. It's a joint effort initiated by the IPCIG, GIZ on behalf of the German Federal Ministry for Economic Cooperation and Development and the Australian government's Department of Foreign Affairs and Trade, in cooperation with socialprotection.org platform and with partners from different organizations. It's the series is part of an initiative which has two other major components. It has a collaborative mapping of country news and documents disseminated weekly through a dedicated newsletter, and an online community on the topics to systemize information and foster discussion. So you can join this online community to learn more about the whole initiative, find out how to collaborate, and keep up with future webinars as the COVID situation evolves. This webinar was organized by the SPEAC-B Gender Working Group, consisting of representatives from a number of agencies who are participating in SPEAC-B. And you can join the Gender Responsive Social Protection online community if you're interested to learn about the gendered impacts of COVID-19. Just in terms of the next upcoming webinar, the next one will take place on September 1st, and it'll cover focus on inclusion of persons with disabilities in social protection responses to COVID-19. And on September 10th, the webinar will focus on the role of social protection in responding to gender-based violence during the pandemic. And so don't forget to register, and there's links posted in the chat box. Okay, so with that, I've already introduced all the speakers. We have an idea of how it's going to go. So try to do it quickly so we can move to the interesting part of the webinar. So with that, I'd like to pass the word to Dr. Torero, the Chief Economist of FAO. Please.
Thank you very much, Benjamin, and thank you very much all for being today in this webinar. As all of you know, the coronavirus pandemic has been a crushing 1-2 punch to the global economy, delivering a dual shock to supply and demand in quick succession. It is a serious threat to food security because even though there is enough food for all and for everyone in the world today, it is not a given that people have access to it. The first jab was the disruption to the global food supply chain, and the second blow is what we are feeling today, which is a huge recession. Surging job losses means that people are losing income to buy food, and it could trigger a food crisis induced by lack of income rather than high food price. But one of the major concerns is inequality, and how inequality will be exacerbated, especially on gender and minorities. And that's the core topic of today's meeting. The economic recession that we're going to face by this pandemic could bring additional 83 to 132 million people that could go into hunger this year. And this is not happening homogeneously, it's happening with differences. And that's where we are exacerbating the differences that we already had, and that's where gender plays a crucial role. So this will be an increase to a situation which today already was not good. We already had 690 million people going hunger. So it's 132 more to these 690 people. So our evidence shows that 80% of the 732 extreme poor live in rural areas. And we know that COVID-19 will also worsen poverty of these people who typically have little or no access to formal insurance, credit, or risk management mechanisms, including social protection. And rural women fare worse than their male counterparts in this respect. And the reason is because the way employment in agriculture, where we have more or less 1.2 billion jobs, of which 35% will be at risk. The jobs that are mostly being put at risk are jobs on packaging, on food processing, on transportation. And most of those jobs are also done by females. So the impact of COVID-19 on females will be higher relative to males. The gender inequalities in access to and control over productive resources, assets, services, and economic opportunities that shape the lives of rural women and girls prior to the pandemic have led to rural women bearing a disproportionate burden in the COVID-19 crisis. Although many studies documenting the full impacts of COVID-19 are still underway, some initial information shows clear gender effects. Here are a few examples of the disproportionate impact of COVID-19 on women. First, reduced economic opportunities and resources for rural women. In Africa, women constitute nearly 50% of agricultural workforce and own 1/3 of small and medium enterprises. COVID-19 restrictions have undermined women's ability to access to resources for productive activities, find finance to keep their SMEs afloat, and their incomes in rural markets. Understand that those inequalities will already exist there, and we are just exacerbating them even more. And liquidity to farmers is hugely important right now, and especially to women. But now it's more difficult because the lack of demand for that food that they were producing, lower prices, and that will affect them and will even put at risk the potential capacities to do activities for the next season. Although globally, informal employment is a greater source of employment for men, in lower and lower middle income countries, a higher proportion of women are in informal employment compared to men. For example, in Africa, 89.7% of employed women are in informal employment compared to 82.7% of men, according to ILO. And in Bangladesh, as many as 92% of employment women work within the informal sector. So informality implies lack of access to labor-related social protection. The absence of inaccuracy and of other safety nets accentuates the vulnerability of informal workers. In the absence of social protection coverage, particularly insurance, women experience larger asset losses, likely as risk management strategies in order to smooth consumption and income due to the shock. In Samoa, 65% of women surveyed reported decreases in income from own farming and fishing since the spread of COVID-19, compared to 21% of men. So in terms of economic opportunities and resources for working women, they are facing a significant challenge today. Second, they have worsened access to nutritious, safe food by women and girls. Yet in America, the number of people receiving food assistance has nearly tripled since the start of the pandemic. In Lebanon, 85% of women are eating smaller portions as coping strategy compared to 57% of men. Women were also the first to give up eating more diverse foods. 66% of women have already made this shift compared to 43% of men. 368 million children around the world have lost access to school feeding programs due to school closures. And clearly, this will affect women more because women were the ones supporting these children and will be the one taking care of the children while they are at home, restricting enormously the capacity to do the activities and their entrepreneurial micro enterprise activities that they normally used to do while kids were at the school. Third, increased barriers and challenges in accessing information on COVID-19. Women are less likely to receive important information regarding COVID-19 compared to men due to their lower access to education, cell phones, and internet. In Pakistan, 32% of surveyed women stated that they did not receive any health-focusing information regarding COVID-19 pandemic compared to 21% of men. Fourth, increasing unpaid care work and unequal division of labor within the households due to closures of schools, public spaces, or care services. I mentioned this before, and in Bangladesh, 55% of women reported increase in unpaid domestic work because of COVID-19, compared to 44% of men. And also, fifth, and finally, increase in gender-based violence. For example, in Hubei province in China and in Singapore, in February 2020, authorities noted 30 to 33% increase over cases reported in February 2019. In the Arab countries, initial information indicates an average increase between 50 to 60%, rising to 400% in Tunisia. So, social protection has been shown to be crucial to COVID-19 response. And in this case, we need to find ways to adapt social protection programs so that we can minimize the inequalities women are facing. And it's essential that we do this change. There are at least 1,055 social protection measures worldwide that have been put in place to respond to the crisis. So how can we ensure that rural women benefit from this response and that their rights are advanced in the post-crisis recovery? This is a major question that we want to answer in this meeting. First of all, rural women must be a crucial part of the post-pandemic recovery. FAO's own evidence and technical guidance shows that when gender is considered in the design, implementation, and monitoring of social protection, it contributes to the empowerment of rural women and consequently to the benefit of their communities. This is especially vital in the COVID-19 response. FAO is advocating for urgent action in the following key areas: design and implementation of gender-sensitive social protection interventions to ensure that rural women can participate in and benefit from these interventions equally, even which should be biased towards women, given the inequalities I mentioned before. Second, support the productive capacity of women farmers by ensuring equitable access to productive resources, inputs, and services for the next production season and beyond. And this should include financial access, giving emphasis to bigger access on female farmers. Third, adopt special measures to support rural women economic activities in the agri-food value chains. Fourth, adopt programmatic and policy-oriented measures to address gender-based violence. Fifth, invest in women's leadership and support their formal and informal networks to contribute to COVID-19 response. And sixth, ensure availability of sex and age disaggregated data and analysis for monitoring gender-related impacts of the pandemic, as well as measures implemented to limit the spread. And seventh, we will need to increase access to information. As the schools are closed, health centers are also being affected. And all this is especially affecting women. And we need to find ways to increase information to females so that we can reduce, again, the inequality that we are observing. So let me conclude by saying that COVID-19 has laid bare the extraordinary precariousness of the world socioeconomic system. Looking at this impact on women economic participation, on the labor burden they are facing, and the increase of gender-biased violence, we can say that COVID-19 pandemic is gender-biased. But the COVID crisis is also an opportunity to rebuild back better. Therefore, our efforts should now concentrate on putting women at the center of the recovery. I hope that through the excellent speakers in this webinar, we will be highlighting how gender-responsive social protection and mitigate the negative impacts of COVID-19 and support rural livelihoods, thereby contributing to the fight against poverty, hunger, and malnutrition. Let's work together to try to find a solution to reduce the inequalities women are facing today, so that this COVID-19 brings once and for all the significant transformation that we need. Thank you very much.
Great, thank you very much, Maximo, for those welcoming words. Next, I'd like to give the floor to my colleague Susan, who again will give us an overview of why gender-sensitive social protection is important for rural women, men, boys and girls in response to COVID-19. And Susan, you have 10 minutes and even less if possible, since we're already going over time. Thanks.
Okay, all right, thank you. I'm going to share my screen. Thank you very much, David, Ben, gosh. Thank you very much, Ben. But also I want to thank Maximo for that excellent speech that has set the ball rolling for us. And actually he's done the first part of my speech for me, because he talks about the impacts of COVID-19 on rural women. So my name is Susan Carrier. Ben has already introduced me. I'm a senior gender officer and team leader for gender at FAO. And I'll be talking about the importance of paying attention to gender when in the context of social protection response to COVID-19. So I think Maximo has done an excellent job of talking about rural gender inequalities. All I would like to mention here is to say that the reason we are concerned is that rural women play an important role in producing, processing, trading of food and agriculture crops. They comprise a large percentage of agriculture employment. So they're important players in this context. However, as Maximo has said, they do this in the context of being very disadvantaged in access to productive resources. And I'm not going to repeat this because Maximo has talked about it, but these kinds of constraints that they suffer are part of the reason why they are more negatively impacted. Already you can see in my list here, time poverty is a huge issue. So if you increase their work burden, then you're really negatively impacting them. My second slide has actually been covered very well. The only thing I would like to say here very clearly is that there's not that much evidence that has been done looking at the impacts of gender impacts from the COVID-19. And I think this is an area that we need to really pay attention to. But as Maximo has said, it's a reduction in economic opportunities, income, food security, nutrition, gender-based violence, and increases in women's work burden. So let me get to the heart of my presentation here. What's become very clear is that social protection has an important role to play. And of course, we've seen there's been tons of social protection measures that have been implemented or put in place to respond to the crisis. What we're concerned about in this context is that, for example, IFPRI did a study in April, and out of the 418 social protection interventions or initiatives they looked at, only 11% showed that they had actually had some degree of gender sensitivities. We ourselves in our team, we looked at looking at good practice. And what we found is that a majority of the national response plans have not consistently applied a gender lens. And when they have done so, they've been limited in scope. So they will target, definitely targeting pregnant women or women receiving maternity benefits, talking about supporting in terms of childcare duties, gender-based violence, but very few have looked at explicitly addressing the economic effects of COVID-19 on women in their responses. And really, they've just not paid attention to gender issues. So we think that further gender sensitivity is going to be necessary if women are going to benefit. So, and why, what are the reasons we think about this? We know for sure from all our evidence that in many instances, rural women are constrained in accessing social protection programs such as cash transfers, public works programs, or even asset transfers. And there are three reasons for this, why women don't benefit equally. The first one is that rural women and men experience poverty differently, and also vulnerability. They are vulnerable in different ways. Part of this is because gender norms actually play a big role in reducing access to productive resources for women, so then they become more vulnerable, but also women are limited in terms of decision making and power within their households. A second reason why rural women face, a second part is that rural women face barriers to participate and benefit equally from social protection. And there are many reasons for this. I've just talked about time poverty. They may not have the time that is needed to dedicate in terms of going to access or to look for the social protection services. They may be restricted in terms of mobility, being able to go where the services are offered. Maximo has talked very clearly about the fact that women are highly concentrated in informal and irregular jobs where social services or social security is not so easily available. Their lower literacy levels means that they may not get the information they need to know what programs are available. We've talked about their care responsibilities, taking care of families. And then the third thing, the third aspect to why women don't benefit or access social protection is that when social protection interventions ignore gender issues, they may, one, increase the vulnerability, they may increase, deepen inequalities in terms of increasing women's work burden. They may at other times actually reinforce traditional gender roles or even create conflicts, intra-household conflicts. So it's really important that social protection programs pay attention and specifically develop ways in which you can make sure women will benefit. So what I would like to share in my last 3 slides, and some of this comes from a policy brief that FAO developed, prepared, that was aiming to provide some support to governments and some ideas of what can be done, is first of all, I'll look at what can be done. How can social protection play an important role in reducing gender inequalities in food security and nutrition? What can be done? And here we have several aspects. The first one is data. Gender analysis, vulnerability analysis to understand who is affected, how they're affected, how are they vulnerable, who is vulnerable. This is hugely important. The second thing is to make sure that all these social assistance programs actually target women, and there's a specific target for women and girls. Conditionalities and relaxing conditionalities can be hugely important in increasing access by women, because conditionalities can address constraints linked to care responsibilities, who takes the child to the clinics, or sometimes it can also help when women have mobility constraints. Choosing the choice in modality, so is it cash, is it asset, or is it food, can really have gendered impacts, especially when women have mobility constraints, and also when they are the ones expected to provide food. And finally, making sure that the information on available social assistance programs is tailored to different target audiences, making sure that women can understand the information. Secondly, social protection actually has an important role in promoting rural women's economic empowerment, if tailored appropriately. So here are some examples, again, that are from the policy brief. The examples include expanding job categories in public works programs to include community-based care or home-based care of young children. As you understand, we had out-of-school children, so really being able to figure out how public works programs can alleviate that burden can be really important. Providing temporary employment and or cash transfers to rural women can also be really important to safeguard their assets. As we know now, women's assets are the first ones that are sold off in times of crisis or shocks. A third area is in terms of establishing a minimum quota for women's participation in public works programs, or providing childcare, offering flexible working hours, and finally, just making sure that programs, social protection programs that promote productive investments actually target women farmers. And then this is my final slide. All that I've talked about, the program can be really good, but we must make sure that the delivery, the implementation, the monitoring and evaluation are gender sensitive. So what are ways in which this can be done? In terms of delivery mechanisms, there is issues such as reducing distance to collection points, or even using ICTs so that women don't need to move from their homes in order to get it. I've already, grievance mechanisms, hugely important. Many times rural women may not be heard, so making sure they're part of that discussion. Strengthening the capacity of implementing staff, government staff, NGO staff, so that they understand what is needed in terms of integrating gender, but also providing very clear practical guidelines for them. For us, we think it's hugely important to make sure you have a gender expert in the team that can help to integrate gender and to provide the expertise and technical support. Strengthening women's leadership and participation in the programs, either in the oversight structures, in the committees, but also even in staffing. All those are important in terms of shaping the programs in ways that can increase benefits to women. Addressing social cultural norms and attitudes, making sure you're engaging with men, you're engaging with all the norm holders in the community, explaining the program so that they also buy into it and support it is hugely important. It's also important in terms of making sure that social protection does not lead to gender-based violence. And last but not least, making sure there is a rigorous monitoring and evaluation framework. Data is hugely important, collecting gender-relevant, sex disaggregated data, and looking at the impacts of these programs on women and men, who's being left behind, who's benefiting. This is hugely important in terms of continuing to shape the programs. As I finish, I would like to highlight some of these ideas about how to make social protection programs gender sensitive are really in two technical guides that FAO has produced. We are happy to share those with you. Thank you very much.
Great. Thank you, Susan, for that excellent presentation and rather comprehensive overview of how to addressing gender within social protection. Two points. First is that we've gotten a large number of questions. That's fantastic. I'm happy to see those, and hopefully we'll get to those at the end of after the panel discussion. Second, the presentations will be shared. Okay, so they'll be up on the website, I guess, in a follow-up email, as well as on the social protection platform. So be rest assured you'll have access to all the presentations. Okay, so quickly next, I'd like to give the floor to Ms. Mongosi, who will share with us some stories from the Gambia. Thank you, please. 10 minutes.
Thank you very much, Mr. Davis. From the Gambia, we're going to be doing this in two parts. I will talk about the situation on the ground with rural women, and the Permanent Secretary from the Ministry of Women, Children and Social Welfare will focus more on the social protection interventions, which cover what the government does as well as what partners do, because we work very closely with the government. And we will also be discussing the current observations since the outbreak of COVID-19. I hope you can see my screen. And the Gambia is a country surrounded by Senegal in West Africa. 3 sides of the country are just on the bordered by Senegal, and then the Atlantic Ocean. So I'll focus more on the issues which relate to some of the ways in which World Food Programme and partners actually end up finding the vulnerable women or the vulnerable populations. WFP and partners work on the food security assessments using vulnerability tools such as MVAM, which I have to apologize for the noise in the background. We have the heavy rains this season, and there's so much at the moment. Apologies about that. So we have actually noted that the socio-economic impact of COVID has been devastating to most families, not just women, but women have experienced the challenges differently to men. Mainly due to the inequalities that existed prior to COVID-19. So WFP has tried to move from just not being gender sensitive to more gender transformative idea. For the past 5 years since the new policy, we've been really driving the agenda of doing in-depth analysis which go beyond sex and age disaggregated data. But the current COVID-19 has exposed that we have not done enough, or even our partners on the ground are not doing enough. In the current VAM analysis, or the vulnerability and assessment mapping, we've seen, we've done desk reviews, and then the MVAM, which is just the mobile vulnerability analysis, where we've already seen that there's challenges with food security, there's challenges, a myriad of challenges, which I'll talk about, which will be the focus of my presentation. In the results of the first and second rounds of MVAM, we have seen that COVID-19 is exposing more people to food security vulnerabilities, and there's evidence already that there's also other vulnerabilities which were not significant before. And the latter, this is the other vulnerabilities, may be due to reduction in economic activities due to containment measures such as restrictions, closure of markets, reduction in remittances, and reduced tourist seasons. I'm not going to spend too much time on this, but these are some of the key indicators for WFP, which already will tell us that there's something seriously that needs attention. We have seen families already applying coping strategies. When we look at the male and female households, we have not seen a significant change, and there's a plausible explanation for that. The government of the Gambia, together with a lot of partners, including WFP and many others, have actually conducted general distributions of food. Some has been for some organizations which are also part of the social protection, which respond to social protection, have also given cash-based transfers to families. As school feeding through WFP and the Ministry of Basic Education has also supported women-headed households, or even the children who were going to school before the closure of schools due to COVID-19. So these interventions, you find that there's still a bit of food found at household level. So their food consumption score is still relatively good, although in some, the different areas have different challenges. And then the other point that I want to raise is the coping strategies. There are some negative coping strategies that communities, when they are threatened, and this is something that Susan raised in her presentation, that the negative coping strategies seem to be employed when there's less food around and less economic opportunities. And it goes from borrowing food to reduction in portion size of what people eat, as well as eating even the seeds which were meant for vegetable gardening. Here I want to try and be brief, but to say this is what we heard from the rural women. We had, I've just spoken about the VAM analysis. This happens 3 times in a year, and there's an ongoing one at the moment. But in April to May, we did a school feeding assessment in 4 regions. There's 6 regions in the Gambia, and with WFP support in 4 regions were raised, and then 2 of the regions to complete the whole country, the government intervenes there. So we did the assessment in at least 4 regions, and the women had amazing stories to tell us in terms of how they've been challenged. But this was more like at the onset of COVID-19. Schools had just closed. They were very, there was a confused state of even the distance learning programs which did not start until later on. And the mothers particularly were concerned about their children, that they're now going to miss out on important meal for the children, which they didn't have to budget for or worry about during the schooling calendar or during the ongoing of schooling. And then we also have we've been working on a project with women in fish landing sites in 2 regions, as well as a peace building project. I must hasten to say the peace building project was an intervention which was planned for this year. So it coincided with COVID-19 pandemic, so we've had to readjust. But talking to the women, they talked about extreme poverty that they are experiencing, that yes, they were poor before, but they were able to get up in the morning and go to their farms and work. And they had planted and they were ready to harvest. So at the onset of the outbreak, when the containment measures such as lockdowns or partial lockdowns were implemented, it meant that there was a lot of food loss, and in markets they had to sell their produce with very low prices to get rid of it so that they didn't have to throw it away. They also talk about some of the challenges which our analysis shows relate to social norms such as patriarchy, where GBV and other forms of abuse is often ignored or even misunderstood, or no one wants to engage with that because it's phrased under very beautiful title, culture. There's issues around maternal health which were raised by women. We had focus groups of men, women, but we still broke down the issues of the groups of women to actually understand how these women were experiencing, older women and younger women. And we found that for women who are pregnant, they say they often have to really struggle because the COVID-19 closure has meant that they cannot travel to a better hospital or to a health center because not all these rural communities have health facilities. Illiteracy is another one where the parents or the mothers and fathers, as well as the younger children, were actually concerned that they are losing out on schooling, and some of them felt like, they don't know whether they will be able to go back to school. And I have to hasten here to say that the literacy rates, adult literacy rates for women are actually lower in the Gambia. The female literacy rates are about 34% according to World Bank, and World Bank 2017. So you can imagine even some of the interventions that we take to these communities when we talk about following the protocols of COVID-19, when we talk about, stage-by-stage interventions, which are often written in English and very difficult to translate to some of the local languages. Illiteracy plays a big role in the way the women are interfacing with what they're facing now. Women talked about closed borders, closed markets, no trade, and forced to sell their crops at a loss, which I talked about. Now, in the intervention where we are talking to women in fish landing sites, they talked about how fish has become very expensive. This is normal at this time of the year, July to October, but the fact that there was no other way of making or engaging in livelihoods, the women felt that, they were really challenged. We also found that there was no running water in some of the facilities where the women were working, making it very difficult under COVID-19. And then we also heard of extreme unemployment. Women lost a lot of opportunities, they lost their jobs, and young people in particular talked about how they were ready to take on the illegal migration as soon as opportunities opened. And through focus group discussions, we spoke to the young widows who are mothers to very small children of some of those who were able to go out of the country through illegal migration. And in-depth interviews with some of them said that, they were now suffering from GBV abuse that the men were aware, and some of them who never returned, means that further challenges are experienced by these younger women, and how they would have, how their lives would have been different is that they would have actually taken up jobs, worked in farms, and done other market trades, but now they are stuck in the home and there's no opportunity. So COVID-19 has really exacerbated their challenges. And women do not own land in the Gambia. These are some of the challenges where we are actually working with other sectors, including with the government, to look into how we can, regional governments as well, to see how we can slowly discuss change in a transformative way, not just to sensitize, but to really think of ways in which we can call for change in the way things are done. Some of the interventions have already started talking about that, but it's really, we've been focused on awareness creation on issues that relate to COVID-19 in our resilience building initiatives. We've come up with new initiatives. We've come up also with integrating the issues around COVID-19 as part of the interventions. We've also, when we do the take-home rations for the children, working with both government, with the government and other partners, we are working to reach about 240,000 children with both cash-based transfers and food interventions. And even the people who come and collect this food are women. And the reason being that the Gambia is polygamy is recognizable and is practiced. And so if we ask men to come and collect the entitlements for the children, we may miss some families. And we're also waiting to support and provide market access, post-harvest losses, and so on. And we're working to establish new community gardens, supporting farmers, and also working on conditional support for cash-based transfers with capacity strengthening skills, but making sure that it's all in line with the COVID response. What are the gaps? There are many, but I just want to focus on 2 or 3 here that we need to increase coverage and target gender responsive messaging. At the moment, you find that the messaging is expected to be understood by everybody, but when you go deeper into the communities, if you cannot read and write, they will think, the women would think that that's meant for somebody else. And we also feel that there needs to be more direct investment on further research on the underlying causes of gender inequalities and girls and women's disempowerment. Addressing challenges of patriarchy in this context is critical, and better investment in health and health services, as well as education and other basic services, which are rights of these women and girls. And then appropriate social protection system with short and long-term strategies that can change lives and save lives. Just a picture there from the fish landing site. You can see the difficult conditions under which women work in. The women would be sitting there because the schools are closed. They take their children to go and work in the fish landing site instead of the learning which is available at least through radio and some other means as e-learning from government. So the women, feel like there's no food in the house, so they take their children there. And with others who are having the right corner picture, you can see we're trying to have a focus group discussion with women, but there's always a man in the village who comes and hides behind the tree and pretends that he likes sitting there. So those are some of the challenges, and we need to really explore transformative ideas. And I couldn't agree more with Susan that we need to really invest in transformative ideas, in ways in which we can work together with government and many other partners to improve our social protection interventions. Thank you.
Great, thank you so much, Lillian, for that very detailed presentation on what's happening in the Gambia. Next, I'd like to move to our panel of esteemed speakers. And let me introduce them again very briefly. We have Her Excellency Navain El Gabaji, the Minister of Social Solidarity from the Government of Egypt. We have Ms. Renana Jambala, the chairperson of the Self-Employed Women's Association, SEWA, in Bara. And finally, we have Ms. Rohi Betaya Darboe, the Permanent Secretary of the Ministry of Women, Children, and Social Welfare in the Government of the Gambia. And so each of you will have 5 minutes to talk about the particular situation in your respective countries, and then we'll have some panel discussion and back and forth. So I'd like to give the floor to Your Excellency, Madam Minister, please.
Thank you very much. It's a great pleasure to be with you this morning, and it's always a pleasure also to coordinate with FAO, IFAD, and all our related international organizations that are more or less involved in gender-based, the protection of the rights of women, especially in gender-based violence, and if it relates to the impacts of COVID-19 and social protection. Mr. Massimo Torero, Mrs. Susan, Mrs. Lillian, Mr. Benjamin, and all panelists. Our intervention in Egypt, I'm just speaking about COVID-19 and gender-based violence at large, and whether the rural women in Egypt, and I think all over, that gender norms and inequalities are disproportionately exposed rural women to shock and stresses. And maybe with COVID-19, it inflates the situation with all the traditional gender norms, with female genital mutilation, early marriage, trafficking, and all the related domestic violence. Also the limited infrastructure in terms of the services at the rural level, disruptions to the rural livelihood, especially that the lack of access to assets and to small and micro enterprise with a great level of informality at the rural areas. Also the lack of schooling and lack of care to the elderly and disabilities leave the women with great burden. Also low capacity to cope with risks. All of these have left results that reduce economic opportunities for women and less access to nutritious food, especially with the food issues and the hunger issues during the crisis. I think also the underprivileged groups materialized in women with disabilities, elderly was more and more accentuated, that left women with productive and reproductive problems. Let me speak about the aim of this webinar is to have an overview of our experiences in our different countries. I think in Egypt at large, women are less likely to have access to adequate social protection than their urban and male counterparts. And the Ministry of Social Solidarity and the Egyptian government at large was more biased to women and Egypt to an extent that 80% of our cash transfers at large was oriented to women in Egypt. Also 75% of the program beneficiaries are in rural areas with special emphasis on Upper Egypt, which is the poorest, because according to the targeting of the poverty maps in Egypt, we were very much keen on the targeting issue. As to the mass interventions after COVID-19, we increased our cash transfer to 411 households, out of which 78% were women and elderly and people with disabilities, and only 22% were men, and these men were taking care of the kids. 58% of them are, or 68% are living in rural areas. 45% out of them are living with disabilities, and also 9% are female-headed households. MOS has also launched an online portal for our cash transfer program for the inquiries and for the to redress all the complaints and the inquiries of women. I think MOS has collaborated with World Food Programs, with FAO, Food and Agriculture Organizations, to increase the women at risk of increasing them with 77,000 households. And the WFP were supported for 3 months during the COVID crisis, during the peak of COVID crisis. We increased this 3 months with additional 1 month. So the ultimate aim is to protect the 77,000 households added to 411,000 households. 96% of those who were supported were divorcees, were widows, elderly, and women-headed households, 49% of which are females with children aged less than 3 years. We also targeted the women who are lactating and pregnant women, around 40,000 households that were provided with food baskets, food ration cards, and provided with additional cash transfer during the 4 months of the crisis in order to save lives for the children, the first children that had during the period of 1,000 days, the first 1,000 days in the lives of children. 1.3 million households from casual and informal labor were provided with temporary cash transfer in collaboration with NGOs, with Ministry of Labor and Manpower, and with private sector. And 400,000 of the most vulnerable households were covered with social care, with cash transfers. Actually, it's not only cash transfer and social protection, it took other forms, because also the nurseries were stopped of working and functioning, operating during this period. So we supported 122,000 of the workers who are working in the nurseries with 3 months of cash transfers. I think MOS has taken multiple precautionary measures to secure the disbursement of monthly social insurance pensions with electronic payments. We also supported them with many facilities in the SMEs in agriculture and husbandry. We increased the number of projects to have their projects managed at their homes. I think We increased also the services to family planning during this period. We provided family planning services through the partner NGOs clinics, because the government clinics were mostly busy with services that were focused on COVID-19. So the NGOs clinics were supporting family planning services because there was an increase in the demand for family planning services, and we also provided awareness through Rapid Pro. The Rapid Pro is an interactive communication platform in collaboration with UNICEF to provide psychological support, especially to violated women or women at risk of being violated, and to provide them with awareness messages. We had a prize competition that was designed aimed at educating families who benefit from cash transfer programs about the seriousness of COVID-19 virus and ways of preventing them. Around 68,000 women and young people participated in this competition. I think a new component also was added on MOS shelters. MOS is Ministry of Social Solidarity shelters for protecting women victims of violence or who are on the border of being violated. We have 8 centers. The 8 centers were open to hosting women who expressed that they are being violated or they were at the risk of being violated, added to online support with psychological support, and hosting not only the women but the children. All of the Ministry of Social Solidarity social care institutions that sum up to around 560 social care institutions for children and women who are deprived of family care were provided with all needed supplies to protect them from infection, whether sanitizers, hand gloves, masks, disinfectants, and thermometers. I think also disbursement of food and hygiene supplies through the Red Crescent and Red Cross. So we provided 500,000 hygiene kits to families in poor and deprived areas, as well as 800 social care institutions, facilitation of loan repayment for indebted women, especially those who were provided with micro-enterprise. We have repaid the late installments for the poorest women who were indebted, mounting up to around 2,000 indebted women. Last but not least, we combated the drugs and substance abuse. A good portion of women, around 9% of the substance abuse and drugs were women. So we extended the work period in outpatient clinics with the presence of specialists who supervise social distancing, but there was dispensing medicines to patients every 15 days to protect those who are being recovered from drugs and substance abuse from recurrence. Last but not least, the future plans is to activate the pension disbursements through mobile and electronic wallets, and to avail 10,000 microloans for women who implement food production projects in order to work on poverty alleviation and on no hunger issues to ensure minimum level of nutrition to women and households. Our recommendation is that during the coming period, we were a bit weak in terms of inclusion of men with women. I think still we need to have more of inclusion of men with women in awareness classes. Also, we have the access to knowledge and technology for women in rural areas still is not strong. I mean, there is many efforts that are being invested in door-to-door, but since door-to-door is not working anymore, so I mean, the access to technology and knowledge at large in the rural areas is an issue. Stigmatization of women who are passing through psychological disorders. So I think the stigmatization of women is an issue. And also the advocacy on sensitization, monitoring and evaluation is still the utilization of these numbers and coming out with policies in order to have utilization-based research and numbers. We're still developing and selling more and more in it. And last but not least is not to work with poor all over as one package, but to have layers of poverty for the extreme poverty and those who are vulnerable to poverty at the border of being poor, those who were scoring less than the poverty score are still poor, but they are not yet provided with the integrated services of social protection packages. So if they are poor, they are provided with the whole package. If they are just one level below the poverty line, they're deprived of everything. So I think we need to work on the layers of poverty. It has been a pleasure to be with you today. I also benefited from the 2 presentations or the 3 presentations that were presented, and I remain with you in terms of any inquiry or comments or anything you need. Thank you very much.
Thank you very much, Your Excellency, for that very detailed description of what the response to COVID in Egypt, covering not only very extensive cash transfers, but also a number of other extremely important areas. If I can ask one follow-up question while we're still on the topic. I mean, at the outset of your presentation, you stressed the importance of gender norms, kind of these structural issues, right, about how women are treated differently within society, gender-based violence. And I'm just wondering, does COVID-19 offer an opportunity to address some of those structural issues, or does it set us back in terms of being able to address these issues? Very briefly, thank you.
Thank you very much for the question. I think the social distancing actually was, we were lucky to have the social distancing and less marriage events during this period. So the early marriage was not there. Maybe female genital mutilation, Egypt has much achieved in this area, but still we need to invest more and more. Because people were panicking were very much keen on the social distancing. We have specific villages that were all infected. So people were panicking of getting closer to each other. So I think COVID-19 maybe increased the level of domestic violence, but decrease the level of traditional violence of FGM, trafficking, and early marriage, because by all means, social distancing was considered by people, but domestic violence in terms of homes was increasing. Thank you.
Thank you very much. Thank you very much, Your Excellency. If next we could pass to Ms. Jamvala from Sewa in India. Are you there?
Yes.
Can I give you the floor? Please.
Yes, thank you. Thank you. So thank you for this opportunity to talk about the situation in India and also the work that we have done. A bit about Sewa. The situation in India first, we are having actually quite a lot of cases in the pandemic. It's about 3.3 million as of today and rising every day. We had a little over 2 months of lockdown starting in the last week of March. And in the last 2.5 months, there has been a lifting of restrictions, but of course the economy is not in good shape at all. As far as the effects of both the lockdown and the pandemic, I'd like to say that it has been less in rural areas and far more in the urban areas. So in some ways, rural women have suffered a little less than urban women have. Now, in the rural areas in India, and as we have heard from others also, most earn their living from agriculture. In fact, in India, over the last 2 decades, there has been a feminization of agriculture as men move to more lucrative work, who migrate out. Women earn their living, a lot of rural women earn their living from livestock, from milk production, goats, chicken. A lot earn their living from weaving, stitching, all kinds of production work. And of course, a good percentage do labor, like construction labor. Now with the lockdown, everything stopped. All income stopped, all work stopped. There was, when you talk about job losses, it was almost 100% in the rural areas. However, government did open the lockdown somewhat for agricultural operations after 1 month. And so, contrary to what was happening in the rest of the country, the agriculturists did begin to work, partly because the harvesting season had just come in. What did the government do? During the lockdown and now extended all the way to November, they have announced free rations, that is free wheat or free rice, in some states also pulses, and different types of cash transfers. The most extensive cash transfer was to women, certain types of accounts, and they were getting rupees 500 a month for 3 months. That's about, in euros, I would say about 5.5 euros. It's not much. It was a very, very small amount actually. So that's the situation overall. However, I come from SEWA, which is Self-Employed Women's Association. It's a women's trade union. We have nearly 2 million members. And I'd like to say what we see from the ground, from hearing from our women, what has been happening. The first and immediate problem was of hunger. And the first 2 months have been very, very difficult in that many families did not have food. The government, as I said, did have free rations, but according to our surveys, in the first 2 months, about 80% of the families had difficulty getting it. However, distribution has improved tremendously, and today over 97% of people are getting some kind of ration. However, that free food is only cereals, and people need vegetables, milk, sugar, medicine, a lot of other basic needs. And for that, they need cash. And with work stopping, cash became more and more difficult. In the rural areas, in agriculture especially, women they were able to go into their fields. They were producing crops and vegetables. However, there was a big difference between how women farmers and how men farmers were able to access, because women would use public transport to get to the market, whereas men had their own transport, mostly motorcycles. Mostly the women farmers were unable to get to the market. And we saw vegetable growers, for example, the first month, their vegetables just rotted in the fields. They couldn't sell anything. The second month, it went up a bit. And by the third month, they were selling about 50% of the vegetables. The rest was rotting. Today, I think it has gone up to 60 to 70%. So agriculture women were able to earn something. But those who are dependent on production, weavers, stitchers, they are still not able to earn anything because the markets have not opened up. The cloth markets, there are no orders. Those who went for construction work and other labor work, they also are not having any earning today. And what we are finding is overall about 50% of people in each household, because households, there are 3 or 4 people who work, about 50% today are earning. And for 2 months, as I said, there was no earning at all. These are from our own surveys in our areas. The biggest tragedy that did happen was that many of the rural families, migrants to urban areas, and about 80% of them are men, maybe 20% are women, and their income stopped. They had no food, they had no transport, and they had to get back to their villages because there was no other way they could live. And so millions of people began walking on foot back to their villages, hundreds of miles. Some died on the way, some got terribly ill on the way, they starved. And the estimates, a conservative estimate, is that 30 million people went back from the urban areas to the rural areas, which meant that there was a huge burden on the rural areas and on the women whose menfolk had come home with nothing in their pockets. Some of the things I've already explained. Oh yes, and another thing that the government did start, once these 30 million or maybe it's more migrants came back to the rural areas, the government started rural guarantee schemes where they would have guarantee for a day's work in some kind of construction scheme usually. And many of these men who've come back have been working on these rural guarantee schemes. But the interesting part is that earlier it was women who were working on the rural guarantee schemes. Now the returned men are working on the rural guarantee schemes, displacing quite a few of the women. What was the role of an organization like SEWA? We heard about NGOs. SEWA is a union. As I said, the government has many schemes, but there are very many vulnerable families which were not able to link with the government schemes. And what we found in every community, about 15% of people just could not get any food, especially when we talked about hunger. And our job really was to identify these very vulnerable people. We found couples, very old couples living alone who could not get to the food distribution center. We found widows with children, and in a few cases, we even found siblings, adolescent siblings living alone who did not have identity cards which would allow them to access the food. And we would identify them either we collected food ourselves, there were many NGOs, and then there was the government, we would link them with food. So the issue is that even when you have a very good scheme, we had 15% of vulnerable people who couldn't eat. Income, it was necessary that we think of alternate sources of income. And one alternate source that developed during this time was that of making masks. And we have hundreds of women now making masks and earning a living from that. Selling vegetables was allowed, still is allowed. And so many women now have taken to vending either vegetables or other types of food. Many women have taken to actually making food snacks, food packets, which they then sell locally. So an important issue is finding alternative employment. Another very important thing that came out was that people needed cash. And the government did have cash in some of the schemes, but it was very difficult for people to go to the banks and withdraw the cash because of the lack of transport, because banks were understaffed. And so there was a very important role played by SEWA's microfinance people who would actually reach cash to communities, distant communities, and especially to the rural women. And it was also, interestingly, an alternative employment where many of the, what we call financial intermediaries, were now making a lot of, were actually making a lot of income just by reaching required cash to women. And finally, what I want to say was, what we saw was a blossoming of grassroots leaders, of women from the community who became local leaders, identifying the vulnerable, negotiating with the government, helping alternative production, and who then and this was one of the things that happened because of COVID, is this growth of digital means, of women coming together on Zoom, on WhatsApp, making WhatsApp groups, meeting on SMSs. And so in a way, many women did come into the modern world, into the digital world because of COVID. I'll end here and be happy to answer any other questions.
Thank you so much for that detailed presentation of a very quite dramatic situation in rural India from the impact of the lockdown measures. And I thought was so particularly interesting was the role that civil society, that SEWA, that the microfinancers played in terms of filling gaps in the public system. And the question I had was actually a question that you started to allude to at the end was, I mean, are there any big structural changes that may be coming out of COVID, perhaps unexpected changes? And one you alluded to perhaps was this, again, this blossoming of grassroots leaders. And I'm wondering, what do you see what is the potential for this, evolving into as India continues to address the COVID crisis?
I think I would say three things. One is that we need to be looking at a lot of alternative employment, because some markets, especially markets, the fashion markets, for example, other markets like that are disappearing, at least for the next 2 years. So what is the kind of markets related to health and to the health needs, to the education needs, which people can access? So I think one structural change is a change in markets. Another one is, and I'm glad you pointed to the local governance. So civil society at local levels. And I think many governments did appreciate the role of these local leaders, these local women. And this is my hope, but we're not sure it will happen, though everybody is trying, is in the government schemes to include them as part of government schemes and government distributions, so that local people get more, or local women especially, get more empowered. And finally, I think one thing that the government has realized and that will increase is that of cash transfers. Because the cash transfers, perhaps the food and the cash transfers, the two most useful things that happen to people. And we, at least in SEWA, have been talking about a basic income. And I think perhaps the government is moving somewhat towards that direction.
Thank you very much. Yeah, no, I was also struck very much by the issue of the liquidity crisis in rural areas and the role that cash transfers could play. Thank you. Thank you again for your intervention. And last but not least, I'd like to pass the word to Ms. Betaya, the Permanent Secretary from Gambia. We return to the Gambia for the last intervention. So please, Madam Permanent Secretary, the floor is yours. Madam Secretary. There we go.
Thank you very much for giving me the floor. Assalamu alaikum. Good afternoon to everyone. Let me just thank the previous speakers, the panelists, for the valuable information shared on this platform. The Republic of the Gambia has a population of 2.3 million, according to the Labor Force Survey 2018, of which 51% are women. The economy of the Gambia is characterized by players in the informal sector, with women playing a pivotal role. And 63% of our micro, small, medium enterprises are micro enterprises, and 90% of these enterprises are informal, with 80% comprising women who are involved in gardening, handicrafts, artisanal, and distributive trade. The government has women economic empowerment very high on its development agenda. Thus, the establishment of the Ministry of Women, Children, and Social Welfare in 2019. With the advent of COVID-19, the Gambia has encountered serious setbacks socially and economically, which have negatively impacted the population, moreover the vulnerable groups, more specifically women in the rural areas who are in the lowest paid sectors and also responsible for unpaid care work. On March 17, the Gambia reported its first case of COVID-19, and like the rest of the world, in response to the COVID pandemic, imposed a state of emergency resulting in school closures, shortening hours of business activities, and indefinite interruption to almost all social and economic activities with the hope of containing the viral transmissions. These measures taken are accompanied by numerous negative socio-economic implications that affect the most vulnerable in societies. And these effects on women and girls may even be worse during post-COVID-19 as they continue to face threats to their safety, freedom, and rights. The current situation, lockdown and curfew, curtail women's economic activities and confine victims of sexual gender-based violence with their abusers or perpetrators, and also threaten access to reproductive health care, as most women are scared of going to these health centers or hospitals or health facilities with the fear of being infected. The Gambia economy is fragile and very prone to shock. Our GDP in 2019 grew by 6%, according to the World Bank report 2020, and the tourism sector accounts for 20% of GDP. Is the largest foreign exchange earner and a major source of employment for women. During the COVID-19, the rapid assessment of the tourism sector and related sectors by the Gambia Bureau of Statistics survey highlights that out of a sample of 266 establishments in the tourism sector, 61.5% are male and 38.5% are female employed in these establishments. The travel ban and closure of international borders heavily impacted the tourism-dependent industries such as restaurants and other hospitality-related sectors where we have women participation very high. With an annual growth rate of 3.1% and poverty rate of 48.6%, according to our Integrated Household Survey 2015-2016, the government of the Gambia in 2016 launched the first ever national social protection policy aimed at alleviating poverty and vulnerability in the country. The long-term vision 2015-25 for this policy seeks to establish an inclusive, integrated, and comprehensive social protection system that will effectively provide measures to safeguard the lives of all the poor and vulnerable people. Currently, our social protection system is suffering a series of shortcomings related to scope, coverage, and financing, together with institutional challenges in design and delivery. Therefore, the coordination mechanism to effectively respond to COVID-19 takes a participatory approach involving all relevant stakeholders as the number of cases of coronavirus continues to increase at a very alarming rate, and concerns are simultaneously growing about the current and long-term effect of COVID-19 on certain demographics such as women, girls, children, people with disability, the elderly, etc. COVID has presented numerous challenges, as I already indicated, for rural women and girls. These emergency regulation measures taken by government to ascertain or contain and prevent the spread of the coronavirus has affected business and impacted the livelihood of family in the rural areas, especially those who earn to feed on a daily basis. Women and children are affected more. Many families feared that they might be worse affected by poverty and hunger than by the COVID virus. So because of the lockdown, this has also impacted the livelihoods of rural women and girls. Food security is a known challenge for rural women and is being exacerbated by COVID-19. Rural women and girls depend predominantly on agricultural production for their livelihood and that of their families in terms of food and income for the family. So the closure of the markets, including the weekly markets we call lumos, these are just open markets like Sunday markets, pose a serious challenge on women because that is the only place where they can sell their products, especially vegetables. The income they earn from their sales is in turn used to buy other foodstuff for the family. The closure of school is another challenge. We have realized that the Ministry of Education, Basic Education, is having some TV programs for the children. But then if you look at the people in the rural end, the children in the rural end, most of the time we have a big challenge in the Gambia when it comes to power, electricity. So it would benefit more the people in the urban area than the kids in the rural end. Even whereas they have electricity, sometimes getting cash power to have the TV on is a problem. And then we realize that in some households, they don't even have a TV to watch. Moreover, attending classes as designed by the Ministry of Basic Education. When it comes to financing too for their businesses, Corona is imposing a lot of negative impact on that. So at the level of the Ministry of Women, Children and Social Welfare, we have developed a Women Enterprise Fund together with support from EU that would be really helpful during post-COVID-19 for the women. So this would give them access to financing of their enterprises or expand their businesses. But the focus is more on rural women as well, because if you look at the entrepreneurship sector, you have more women in the rural end involved in these small businesses. So the government of the Gambia during this COVID-19 pandemic, to mitigate the impact, they have initiated the National COVID-19 Food Assistance. Now this is to support social and economic intervention to the most vulnerable households in the Gambia. The intervention included the distribution of food, rice, oil, and sugar to about 86% of households in the entire country. From the social safety network with support from World Bank and government of the Gambia, we have a project we call NAFA Quick Project. This is a program to the tune of $10 million. So 83,000 households in 30 districts that are included in our social registry are provided with immediate unconditional cash transfers of $1,500 per month, and this would be within a period of 4 months. The intervention is currently ongoing, and then we have a NAFA program proper. This will continue after the NAFA Quick, and this will support 15,000 households, extremely poor households in 20 districts for further 18 months. With UNICEF, the Ministry of Women, Children and Social Welfare supported 1,000 vulnerable households with children aged 0 to 5. And with the Ministry of Trade, my ministry made arrangements with the private sector to purchase the onions that we are harvested this year by the female onion growers at market price. Sanitary materials were also given to market vendors, some healthcare centers, and the shelter for children in the Gambia. The Federation for People with Disabilities were also provided with sanitary materials and bags of rice. 6,500 workers in the tourism sector are also provided with cash transfer of $80 by the government of the Gambia and UNDP, that is the United Nations Development Program, to assist the people in the tourism sector, like the drivers, the hoteliers, etc. With ECOWAS, our regional organization, we have a project as well through PAPEF. This is a project for children on the move and on the streets, where we supported 50 majalis. These are the Quranic recitation centers, 50 majalis with food stuff, and then other materials like clothes and shoes and bags for the children. They also dug a borehole, solar powered, at the shelter for children in the Gambia. With WFP, we have, following the Plorong school closure, WFP and the Ministry of Basic Education agreed to implement the take-home ration and cash-based transfer as part of our interim solution to children who benefited from the school feeding. I think my colleague Lillian has elaborated on that. So they're supporting 240,000 children. Now, for our policies, we are looking at creating a national budget line for school feeding to support other regions where we do not have WFP support for this school feeding program. During this period, we were able to launch a hotline for sexual and gender-based violence, which is a cause for concern. And then COVID is really slowing down the enforcement of the law as far as sexual and gender-based violence cases are concerned. So we have launched a hotline, 1313 for gender-based violence and a 199 for children hotline. The National Agriculture Investment Program development to empower, women farmers is also put in place. And then at the level of the ministry, we are reviewing the gender policy and all the acts that are related to women, especially the Sexual Offense Act and other acts. Now, as I said, for the implementation of the web, we are looking forward to this so that at least we can empower the women financially to be able to grow their businesses and expand their businesses. So for social protection, it has become a center stage for our policy dialogue, and we are looking forward to working with all partners to ensure that solutions are given to the problems that rural women are really facing in the Gambia when it comes to their livelihoods, the taking care of their families, and then the problem with their perpetrators or abusers when it comes to sexual gender-based violence. Thank you very much. That's all I have for today. I welcome questions and comments, if any. Thank you.
Thank you very much, Madam Permanent Secretary, for that very comprehensive review of the response in the Gambia, in the situation. We've actually run out of time. We're a bit over time, in fact. And so what I would like to do, I would like to thank all the speakers who participated in the webinar for sharing their time, for their experiences, and for the audience as well for their time and the excellent questions. Now, there are a number of questions, including for the Gambia, which are on the question and answer platform. And we'll be gathering all these questions and we'll be asking panelists to provide written answers. And then this document will be made available on the COVID-19 community page on the socialprotection.org platform, okay? And they'll post a link again for you all. And so because there's a number of questions that we didn't get to, we went over time, but I thought the presentations were fascinating. A lot of very interesting, very different situations in the different countries that were described with different responses, and I think illustrating some of the new heroes emerging in the dealing with the COVID-19 crisis, and really underscoring the role of gender responsive social protection and of rural women within the COVID crisis. And so, again, I would just like to thank all the participants for your time, for your participation, and to thank the audience as well. Thanks.
Thank you very much.
Thank you for the opportunity.